Second time. I call the member for Upper Hunter.
Thank you, Mr Speaker, and I rise to oppose this bill from the shooters and fishers on a number of grounds. Firstly, may I acknowledge the members of the gallery here. Thank you for taking the time to come and listen to this debate. I'm sure you have quite strong opinions and done your homework around developing those opinions. So have I. And a lot of my homework and a lot of my opinions have been developed from ongoing lengthy discussions with residents of aged care facilities, operators of not-for-profit aged care facilities and others. I too was chair of Strathern Aged Care Facility in Scone for quite a number of years, some years back. I understand the workings and the requirements for quality health care in aged care facilities. I've seen it, I've managed it, and been able to spend a lot of time in the aged care facility or in the aged care sector. In particular, again, going back and forming my experiences based on discussions in particular with residents and their families. Mr Speaker, the member for Orange mentioned a number of things in his speech. He particularly referenced Merton Court, and Merton Aged Care is a wonderful facility in my electorate in Denman. And it would have been wonderful for him to show some degree of respect by at least getting the name right. It's not Meriton Aged Care, it's Merton Aged Care. And he also mentioned that his staff had spoken to staff at Merton Aged Care, and I have an email here confirming that the manager has advised that she is not aware of any of her staff, and this is after talking with her staff this morning. She is not aware of any of her staff, because they said so, talking to anyone about the RN issue. Now, this is a not-for-profit small provider of 17 beds in Denman. This is a not-for-profit small provider. Now, I asked Mr Speaker, has the member for Orange misled the House on this particular issue? Did he or his staff actually have any discussions, or are they actually making it up? He also mentioned that Sue Thompson from Maclean Care, had written to radio personality Ray Hadley supporting this particular bill. Well, Mr Speaker, I have that letter from Sue Thompson to Ray Hadley, and there's a number of aspects to it, and I'll just read out a couple of points. It says, in part, to be clear, passing of such a bill that replaces the Public Health Act will have no impact on Maclean Care, given that they already provide 24/7 RN coverage. The real issue is about the impact on small, rural and remote organisations across New South Wales. And she says it further, there would be significant unintended consequences for small, regional, rural and remote facilities if the legislation were to be passed that meant all aged care facilities, nursing homes and hostels were required to have a registered nurse on duty 24 hours per day, regardless of whether the services are providing clinical care or not. She goes on to say, legislation of this nature would deny these small providers the flexibility required to appropriately respond to the changing mix of care needs within their service, where at times it may be that more RNs are needed and other times the limited care funding might be more productively spent on additional allied health services or care staff numbers to support their residents. The costs of employing an RN 24 hours a day, in brackets 3 8-hour shifts, for a 12-month period under the current ACS New South Wales and ACT Enterprise Agreement, inclusive of all on costs, is around $628,271. Now, Merton Court has actually given some information in a document going to MPs, members of Parliament, which states that if they were imposed, or this was imposed upon them, they would have a loss. This is a not-for-profit organisation here. They would have a loss of $389,543. Now that's just one example. So I would also ask that the House take note that the comments from the member for Orange have also been somewhat misleading with regard to Mrs. Sue Thompson and her, as I've pointed out here, in her correspondence with Mr. Ray Hadley. Now, I'll get back to the issue at hand more importantly. This bill, in its overview of the bill, says at present under section 104 of the Public Health Act 2010, a registered nurse is required to be on duty in a nursing home at all times. The object of this bill is to ensure that this requirement is continued. That's what it says. Now, line 13 on this huge document says, a facility at which a high level of residential care, however described under or in accordance with that Act, is provided, or a facility of a class prescribed by the regulations. It goes on to say, note the definition of residential care in the Aged Care Act 1997 of the Commonwealth is as follows. Residential care is personal care or nursing care, or both personal or nursing care, that is provided to a person in a residential facility in which the person is also provided with accommodation that includes appropriate staffing to meet the nursing and personal care needs of the person, and meals and cleaning services, and furnishings, furniture, equipment for the provision of that care and accommodation. Nowhere in that does it delineate between high care levels required or low care. So the effect of this is that RNs 24/7 will be required across all facilities. Now, if that's not the intent, why is it written that it is the intent? Why is it written that it is the intent? Now that actually contradicts what the requirements and the reality of care is all about. On the Nurses and Midwives Association Facebook site, they had, fair enough, rightly so, they had a promotion about calling people to come and have a listen to this debate today. And a Reverend Stephen Harris, who lives in my electorate in Stroud, made a comment on that particular Facebook site, on that post, and he says, the concept promulgated these days is client-focused care. 24/7 RN coverage directly contradicts that in rural areas. This is from Reverend Stephen Harris. Under 24/7 RN, small rural facilities have two choices: slash care in other ways to pay the RN coverage, or residents simply are isolated from family and friends in their end days by being 100 kilometres or more away from their family and friends. These residents currently have family and friends nearby dropping in on them, and RN coverage that involves hands-on RN care 5 days a week, with out-of-hours on-call availability, thereby meaning that the RN coverage observes their first-hand needs. Another comment on that particular post, directly under Reverend Stephen Harris's comment, was from a lady called Fiona Newell. I work in a small rural aged care facility. Mr Speaker, I seek an extension.
Question is the member's time be extended. All those of that opinion say aye. Aye. The contrary, no. I think the ayes have it, the ayes have it. Member for Upper Hunter.
Thank you, Mr Speaker. Again, I repeat, Fiona Newell. I work in a small rural aged care facility, which is a non-profit run by our rural community for our elderly residents. RNs don't work 24/7, 24 hours 7. We are on call if needed. If forced to work 24/7, there is a high chance the facility could close. As one of the leading employers of our community, many jobs would be in jeopardy, not to mention displacement of our residents who would have to be placed in a care facility kilometres away from their families. There is also two sides of the story. What might be needed in the city for extremely large nursing homes isn't right for the country. Mr Speaker, these are quotes and information from people who care for other people, people who live in small rural communities, who are very concerned that the particular requirements of this legislation is going to put their aged care facilities at risk. Another quote from a lady, Debbie Bruns, who lives in Denman, wrote to me last year and partly says in her letter, "I'm very alarmed that it is a New South Wales government requirement." I'll just correct her there, but I understand why she would say that, because everyone thinks of whoever it is as the government. For all nursing homes to have a registered nurse on duty 24 hours a day, 7 days a week. I find this quite ludicrous. I note that no other state has this requirement. I question why a facility like Merton Court needs RNs on duty 24 hours a day. I also question where the government think we, along with all other aged care providers in New South Wales, might find enough RNs to provide this service, especially when our hospitals are struggling for staff. As a member of the Denman branch of the United Hospitals Auxiliary, I know firsthand that attracting RNs to rural areas is near impossible. I also know of the exorbitant cost involved in employing agency RNs. Mr Speaker, there's more and more and more evidence that this particular bill needs to be defeated. It needs to make sure, we need to make sure that we actually do support our small rural communities. As a National Party member in Upper Hunter, I can assure you that my focus is wholly and solely on protecting those people who are vulnerable, who require aged care, and the services are actually provided as close to their community as possible, ideally in their community. We are fortunate enough to be able to have wonderful facilities in my electorate. I've been contacted by Corindai, Denman, Stroud. None of them support this, because they also support the genuine quality care that is required by individuals, which doesn't need to be mandated in terms of minimum staffing numbers. What needs to happen, they all agree, what needs to happen is that they require the ability to be able to provide the appropriate care levels for their families to be able to visit the residents, for the residents to be able to participate as much as they possibly can in community activities, but importantly, to get the care that they require. Mr Speaker, in closing, another email from Shani Mitchell, who is the manager at Merton Living in Denman. And in part, it says, quotes from our residents and doctors. During our recent accreditation audit, one of our doctors spoke to the assessors and, quote, "Tick all the boxes, they are wonderful here, they do a great job." Then she goes on to say, "We have a great doctor coverage here in Denman at the moment, and they visit Merton Court, and they all visit Merton Court to see their patients. They also facilitate their RNs to visit Merton Court to give B12 injections, flu vaccines, INRs, etc. Merton Court is on the Hunter New England Health land, and an MPS adjoins Merton Court, multi-purpose service. The MPS has a 24-hour emergency service, and i.e. there is a registered nurse on duty 24/7 which Merton Court could access. Now, Mr Speaker, I can tell you that the MPS is within 10 metres of this particular facility. They have the ability to have 24/7 RNs without this being mandated.
The member's time is